So we were talking about end of life, we were talking about patients having, most likely the patient is gonna go to having constipation. An HIV person that their viral load is below 200, most likely, even though that person is not drinking enough fluid, that person is going to have diarrhea. Okay?
You said less than what?
200
Okay.
for the CD4. HIV positive patient. Most likely, if the CD4 is below 200, they're going to have chronic diarrhea. It may be just a little bit that comes out every time, but it's going to be chronic because it's going to be for months. So it's really, really important. And oftentimes medication do not work.
In the case like that, you keep hydrated?
I'm sorry?
In the case like that, you keep hydrated?
We need to hydrate the patient. Because if the person is dehydrated, what's going to happen? They're going to start having cardiovascular problems and they're going to die of cardiovascular, because their cardiovascular system is compromised. We need to listen to the person, right? And answer accordingly. If the person is asking for a medication that they do not have, well, we may have to call the provider to find out whether or not that person can take that medication.
I have a question.
Yeah, go ahead.
So if they're, let's go back to the patient where their CD4 is below 200, chronic diarrhea, medication won't work. So that is a scenario where you would hydrate a patient if they were on
Correct.
hospice? Okay, thank you.
You're welcome. And what you have hydrating that patient, most likely they're going to have more diarrhea, right? Because now they have more fluid. All right. And that also means somebody that has diarrhea that you have to provide care, right? Every single time. So, what do we want? We want to keep we're going back to safety, keep the person safe. If the person is at risk for harming themselves or others, we're going to take some precautions in order to not allow that person to do the injury that they're planning on doing. So if you know that the person normally has a fork and a knife, we may have to start giving that person a plastic fork and a plastic knife. All right? How about if the person at the end of life doesn't have housing, doesn't have food? We can talk to a social worker or send a social worker a message to come and see that particular patient, right? Because we're not the ones that find places for that person, place the person in a facility. The social worker will have to do that. Social support, that person may need to go to groups, certain groups that will help the people that are going to similar experiences, right? Because it's never going to be the same experience. Each individual is going to have a different experience, but they're similar. So they can talk to other people about that. Then establishing self-routine care. Think about patients that when they're home, they're taking, I know I said this last semester, when they're home, they're taking their medications, I don't know, 10 in the morning or 6 in the morning. But now when they're in a facility, we give them the medications at 8, 9 o'clock, right? That we are outside that person's routine. That may cause a problem on that particular patient. Using positive coping strategies and coping skills, right? Somebody could have a whole bunch, a whole list of coping skills, but they are negative. May include smoking when they get stressed, using alcohol, screaming, right? So all of that is negative. We need to find and encourage that person and teach that person about positive coping mechanisms that will help the person. So one coping mechanism may be that when the person is upset, to listen to music. That may work for that person. We're going to develop a plan that it works for the person, that the person is participating. And we know because of that, that most likely the person is going to follow it. Okay? So, what happens when we give somebody morphine? The person is going to be sedated, right? We talked about that. the person may have mental status changes, they may say things that they may normally will not say, right? But now they're under the influence of something, so that may change in how they behave and what they say. So, pre-death could be when the person was first diagnosed of that end of life. So it's before the person dies. How is the person is going to feel? Not only the person, but the family member. It includes anger. Believe it or not, for some people, they may be happy. Because the person may have known for years that something was wrong, and they couldn't find anything. And now they found something. And the person is happy because the person knew all this time that something was wrong and finally was diagnosed. But for most people, there's going to be anger, there's going to be sadness. Absolutely. How about fear? Active grief is after the person died. The person, once again, could be in denial that their family member has died. Obviously, the person is going to have some relief that the loved one is not in pain anymore. Then we have the integrated. Integrated is when, even though inactive, the person may have some relief that the person died and is not suffering. In integrated, definitely, the person feels much better. And the person has found ways to remember that person in a positive way. Like saying, for example, the person is in a better place. Prolonged is when the person is still grieving after years after that loved one has died. However, we have a lot of mothers in here. Nobody ever expects, right, or not expect or think that their child is going to die. So if your child dies, a lot of people, of course, rightfully so, are going to have prolonged grief, right? So prolonged, once again, is when the person, even after years after the loved one has died, the person is still feel as if the person just died today or yesterday. That person may have difficulty enjoying life because the person is suffering so much. Think about a couple that they were together for, I don't know, since high school, and the wife died when they're in their 80s. Every day he went down the street, got coffee, brought the coffee, and bagel. They had breakfast together, lunch together, dinner together. And they were together for so long. How that person? I don't blame that person for being on prolonged grief, right? Okay, what's next? So here is where we want those 5 stages that we discussed earlier. So we're going to go the 5 stages of grieving. Denial. I'm not sick, I'm not dying. Anger. Why is this happening to me? Bargaining. If you give me 2 more months, I'll be so good. I will donate, I will volunteer. Depression. I cannot do this anymore. I can't take it anymore. Acceptance. I know I'm dying in a couple of months, what I'm going to do tomorrow, I'm going to plan my funeral, and I am going to start today to get my family ready. Uncomplicated. What does that mean? It's pretty much the natural, healthy way to accept that somebody has died. It's the natural, healthy way to cope when somebody dies. What does that entail or include? Sadness. The person may feel empty. That person also may have some pain. And that pain is going to decrease over time. Also, with the uncomplicated, the person may have memories of the person. The person may have nightmares about the person. I probably should say nightmares, maybe a dream about the person. I think I used the wrong word. Dream. Oh, all right? And the person then would return to normal activities in a month or so, or it could be a year. So we normally call complicated grief if the person moves through the process within 1 year.
What was that, Jose? It becomes complicated, it becomes rules.
If it's past 1 year, then it would not be uncomplicated. Then we have a traumatic one. This is what the person once again cannot cope with what just happened. Very difficult for the person to adjust that the person is no longer alive. It often happens when the person did not get a chance to say goodbye. That's why saying goodbye to somebody is really, really important. You never know. Or we never know. Okay? Complicated. That when it goes over a year, okay. This is prolonged grieving. The person may not be able to find a way to move forward, but the person is unable to move forward. Guys, this can last for years. The person may not be able to accept the loss of the loved one. They may have changes in emotions. They may have anger, outbursts when they start screaming. They may not be able to have a new relationship or form new relationship. And they may have changes in appetite. So that could be that the person may be eating too much or too little. Changes in sleep habits, sleeping too much or too little. Or waking up in the middle of the night and not being able to go back to sleep. Or going to bed and not able to follow sleep. Person may be tired all the time. So, we always attend to whatever is happening mentally and physically with that person, and we talked about that earlier. What is our concern? Safety, right? We're going to look at what's happening to the person physically. Is the person able to walk? If the person their breathing is so prolonged that they don't want to get out of bed. Very important. Does that person need services, like social services? Do they need Meals on Wheels to have meals prepared for the person because they're in such grief that they cannot function anymore? So once again, we're going to listen to the patient. We're not going to give reassurance to the person in terms of if the person saying, well, do you think that I have 4 more months? We don't know. So we cannot reassure the person about that. What we're going to do is listen to the person. And we can turn it to, when the person says, do you think that I'm gonna be leaving for another 4 months? We can turn it right to the person, well, why don't we do some research? And people that have the same signs and symptoms and the same diagnosis that you have, and make the person look up the information. Right? Could the person have a negative coping mechanism in which they go online and just go shopping?
What's negative about that?
That the person doesn't have the money to pay for? And they're gonna max those credit cards, but they did, that right? So, all right. Question number 7. All right, so what do you think of A?
Yes.
You like A? We're gonna leave it. How about B?
No.
How about C?
No.
How about D?
No.
Okay, so the answer is A. All right, question 8. All right, so what do you think of A? Leave it or?
Leave it.
Okay, B. Okay, read up C. D. So the answer is A. So, next topic is disaster, and then after that we have one question, and then I have a whole bunch of questions for the document. Yeah, we got time. Okay, so give me some examples of natural disasters.
Hurricane. Earthquake.
Earthquake, hurricane,
Fire.
fire,
Flood.
flood.
Car accident.
Tornado,
All right, very good.
sinkhole,
All right.
tsunamis.
So the good thing is for some of those, we find out ahead of time, right? And measures can be taken so people can move out of that area, try to evacuate. For other ones, we don't. So I'm from Puerto Rico, we get hurricanes all the time, we actually get earthquakes in Puerto Rico all the time. But they were on like 5, 5.5. Didn't even leave the house. Hurricanes in Puerto Rico was like nothing, they were thundering. I would be down the street from my parents' house. It's a river, I would be down there. It was normal. However, when I moved here and there was Hurricane Bob, everybody was frantic, you know, like, how do you get here? It's just like, maybe we will lose power. Like, why are you so, but then I realized, so this is, remember, this is like 30 years ago. Then I realized, I'm like, oh, wait a minute, hurricanes don't come this way. So that's why people are acting like it's the end of the world. So Hurricane Bob, some of you may know, I slept through it. Because I went out with some friends the night before, so that day, I slept through the whole thing. When I wake up, there was no power. And my friend Joe was like, you slept through the whole thing. I was in here. I almost peed myself. I'm like, I just lost power. Nothing else. So, but once again, you have to do where you came from, right?
Right.
So that's really important. However, if we have an earthquake in Massachusetts at 5.5, everybody will be running. I probably will be still putting some plants in my house, what everybody's running, because I'm used to it, okay? So once again, for some natural disasters, like a hurricane, normally we have plenty of time to get out of the way. That doesn't always happen because some people think that it's gonna turn and they decide they're gonna stay, right? But that's not what we're gonna discuss. So it's really important that we're prepared. Prepared doesn't mean that each one of us has to be prepared. I'm talking about the facility that we work with. That facility has to be prepared because it's an emergency, right? That means that we're gonna have an increase in patients. And it's not a level one, it's not an acute, well, it will be acute, but they will have injury. So it's really, really important. How do we determine which patients we have to see first? So we're gonna triage, that means that we're gonna assess the patient. And that assessment, what are we looking for? Yeah, airway to the ABC. So if somebody's breathing normally and have a minor cut, are we gonna put that person on top of the list? No, that goes to the bottom of it. But if somebody that is bleeding, and we can tell the person is bleeding and we try to stop it and it doesn't stop, that means that person is gonna go to the top of the list. Very important to do that. Why? Because the people that need the services first should be the first people that we take care of first. So, when it's a disaster, we may have every warning, such as a hurricane. We know the possible path that that hurricane is going to take, so we take measures. One of those things is, if in Florida, most likely 13 areas of Florida are going to be evacuated. That means that emergency personnel will have to be prepared. That includes bringing people from other states into Florida before the hurricane gets there, because if the hurricane is already there, most likely they will not be able to get there. So that's really important. The disaster event, what does that mean? If the actual disaster is happening right now. And when it comes to nursing, this is the stage that we are prepared for. By going to school, passing the NCLEX, and then getting to work. If we're going to do the triage to make sure that the services that are needed are given to the person in a facility. As a nurse, we have a disaster today. Let's say you're a nurse already. You're finished. You're off today. Could you volunteer to work today with pay? With pay because we have a disaster. Yes, of course. So it's really, really important. So, there are times that we have to, during the pandemic, was that a disaster? The COVID-19. Yes, it was a disaster. So what happened with people? You were working, people that were working in the healthcare field, let's say as a CNA. Did you get a bonus for going into work certain days? Yes, so that's what I'm talking about. We knew about the disaster, well, to a certain level, and we tried to help people, but we were overwhelmed, right? Are we prepared now for something similar?
Yes.
Are you sure about that? I really don't think we are. No? Warnings were there, and we were not prepared. So I really don't think that for something like that, it's still going to be a disaster. The only good thing that happens for nursing during disaster is the amount of money that people make. That was the only good thing. All right? Other than that, it was a disaster. So, we are going to try to help the patient with whatever physical illness that they're having, but we also have to treat the mental illnesses. There's going to be an increase in depression, right? Anytime there is a disaster, there is a decrease in depression and anxiety. Now, oftentimes, depression and anxiety go together, right? For many, many people. Some people may only suffer from depression. Some other people may suffer from anxiety. But a lot of people have both. What else do you think is important when there is a disaster? Education. We have to educate the public in things that they can do and cannot do. When can they help? When they shouldn't be helping? When they should stay at home? When they should go and for shelter? So it's really, really important. Question now. What do you think of A? Somebody say no. How about B? Okay, so no. C? And then D? the answer is? So, when I get to my office, once again, I will upload this, but I have something else, we're not going anywhere. Two things. So, this morning when I got to my office, I had a note that said, please distribute to students. If somebody would like to be the student speaker for graduation, not for meetings, but for graduation, have the paper. Some people say, the way they just look. So I have it right here, you can come down, read it, if you don't want to do it, that's fine, but you should at least read it. You may have a friend. All right. So, I have some questions. Don't go anywhere. Too early. See the question. You see it? Anything in the back?
Yeah.
Yep.
Why do you think I'm a good speaker? You're gonna upload these too, you said?
Yeah.
Oh, thank you.
Yeah, you are.
D. Just.
So what do you think of A? B? C? D? Okay, next question. Okay. B. D. And C? Yeah, and the answer is?
I have a question on that one. What is it called, like, I've seen it, you probably know, the day before or 2 days before, all of a sudden they have like energy and everybody's like, oh, you're doing so much better. And what is that called?
Upward journey.
I have no idea what it's called, but yeah, the patient, when they have more energy.
It looks like they're gonna, yeah.
Yeah, we have to do a part of like,
Yeah.
maybe 4 days before he passed away, all of a sudden he started walking and I was like, okay, we're done.
Yep.
Yeah.
Jesus.
I spelled it reality check,
Rally.
Rally? Okay.
because it was painful. And if we have a lot of people in the house that day, some people started thinking that,
They're better. Yeah.
and I was like, no.
Should it be a part of acceptance? No, it's like all of us. It's crazy. They'll be like, this, that. And then it's
So what do you think of A? B? We're gonna leave B for now. C? D? And the answer is? What do you think of A? B? B? C? D? And the answer is? Next question. So what do you think of A? We're going down to answers. A, what do you think? B? C? And D? And the answer is? before I move to the next question, does anybody have any questions about anything? Comment? Concern?
Is your Rally?
What do you think of A?
Was that what we were just talking about, Rally? No.
What do you- So, when the person is near death, what's gonna happen? So they have a decrease in bodily function. So if that would have put 2, 3, 4 days before, then the answer most likely would have been A.
Oh, yeah. I've seen the fever too, though.
Huh?
I've seen the fever
Yeah.
too, a couple days before.
So fever usually, the person has cancer, it's HIV positive,
It usually decreases though, it'll usually drop right
No,
before they
it's
die.
3 to 4 days.
but this, some people increase it, depending if it's like cancer or HIV. So remember, the question in the exam is gonna be what the normality,
But
not outside the norm.
But not the chills, that's why I think difference, 'cause it's a fever chill.
No, 3 days, 3 to 4 days before.
I don't remember how many questions, there's 8 or 10. is
I
there?
said fever, but I don't think it's chill.
Feel free to use any one of these.
Is it, yeah, that's a normal response. Fever.
Funny. Yeah, I use it all.
Beautiful.
8 of them are gonna be on this exam and the rest are gonna be in the final.
That's awesome.
That's fine.
We'll take our chance.
Yeah, I'm not doing, I recorded the review, but I have to delete it because, we haven't sat down to go through the questions, we go through the questions today. So I will record by Wednesday and I will upload, the questions are very similar to the questions that we went over during the PowerPoint. However, I just want you to memorize those. When I say similar, I'm talking about some of the words making the same, but the answer obviously is not gonna be the same. Right? Done. All right. A. No or yes?
No.
B.
Yes.
C. D. And the answer is? And let's move to D. A.
I think that's not even. Yeah,
So what do you think of A? How about B? So what B will be?
can't
C.
believe. No,
What will be C then?
deny that it's not believing.
It's just which one?
Yeah, it is depression. D. So D will be which stage? D. Assessment. Well, assessment. And then A? So A, you like A? B? And then B, okay, C? D? The answer is, got me, got me. I think we have one more question. How about A? B? C. D. The answer is. What?